The George Washington University School of Medicine and Health Sciences Office of International Medicine Programs has facilitated medical missions to Haiti since 2004. We provide human resources for health and capacity in the form of professionals and graduate students in healthcare. In partnership with Project MetaShare for Haiti, we serve the Department of Centre in the Haitian Central Plateau on the border with the Dominican Republic, home to a historically marginalized rural Haitian population of 700,000. GW Students for Haiti is a student-operated and funded interdisciplinary organization committed to the improvement of the quality of life of all Haitians and the improvement of the services that International Medicine Program missions provides them. To this end, our focus has become raising awareness, performing field research, and generating interdisciplinary collaboration between students at GW, other universities, and professionals contributing to the quality and sustainability of life in the developing world. A portion of the funding for our continuing programmatic efforts is provided by a generous grant from Dr. Jeffrey Ackman, Dean of the George Washington University School of Medicine and Health Sciences.
Good evening. Welcome to the George Washington University. My name is Jeremy Akers. I'm a Master's of Public Health candidate here in Global Environmental Health and a physician assistant student at the School of Medicine and Health Sciences. Welcome to the GW Students for Haiti panel discussion on international aid and development. We have a fantastic panel for you tonight to talk about team building and some of the challenges that come of using different metrics, how we quantify success, and some of the great work that they've been involved in thus far. This evening, we're very pleased to have with us Ambassador Charles Ries, who's the Vice President International at RAND Corporation, where he oversees RAND's international offices and their growing international presence. He's a senior fellow there since 2009, his research focusing on the economics of development. He's also served for 2 years as director of the RAND Center for Middle East Public Policy, and on leave of absence from RAND in 2010, Ambassador Ries served as executive vice president of the Clinton Bush Haiti Fund. His 3 decades in the U.S. diplomatic service included an assignment as coordinator for the economic transition in Iraq at the U.S. Embassy in Baghdad from 2007 to 2008, where he was responsible for the oversight and coordination of assistance and economic policy initiatives. Before that, he was the U.S. Ambassador to Greece from 2004 to 2007, Principal Deputy Secretary Assistant to the Secretary of State for European Affairs from 2000 to 2004. In earlier assignments, he was also Minister Counselor for European Economic Affairs at the U.S. Embassy in London and Minister Counselor for Economic Affairs at the U.S. Mission for the European Union. He served as Deputy Assistant for U.S. Trade Representative for the North American Affairs and was a member of the NAFTA negotiating team. He's the recipient of State Department's Cordell Hull Award for Senior Economic Officers, Distinguished Honor Award, Presidential Meritorious Service Award, Rockwell-Schnabel Award for EU-US relations, and several Superior Honor Awards. For his service in Iraq, he received the Department of the Army's Outstanding Civilian Service Award. He is a member of the Board of Directors of the Academy of American Diplomacy. Also joining us this evening, we have Eileen Whitcomb-Smith, who is Deputy Coordinator for Assistance in the Office of the Haiti Special Coordinator at the United States Department of State. She's a foreign assistance professional with nearly 19 years of experience at the State Department and USAID, focused on aligning foreign assistance resources with policy goals. Mrs. Smith has coordinated assistance throughout the interagency with the National Security Staff, the Office of Management and Budget, Treasury, Defense, Energy, Commerce, and congressional committees. She has good experience in Southeast Asia, Central Asia, the Caucasus, Lebanon, China, and Haiti. Mrs. Smith has a Master's in National Security Strategy from the National War College, a Master's in International Politics and International Business from George Washington University, and a Bachelor's in Political Science and Russian from Emory. Also with us this evening, we have Nadia Volchansky, who is Assistant Professor of Interior Architecture and Design at GW Columbia College of Arts and Sciences. She's a designer with experience in corporate hospitality, retail, and higher education projects centering on the healthcare market, collaborative social responsibility, and sustainability. She is director of Anudan Haiti, which is an international interdisciplinary initiative that focuses on developing sustainable healthcare infrastructure to meet the needs of Haitian communities. Also with us this evening is Sydney West, who is the Senior Program Officer for the American Red Cross Haiti Assistance Program, $421 million initiative, multi-sectoral response, which has directly benefited over 4.4 million Haitians since the earthquake of 2010. Also with us this evening, Jay McGinnis, physician assistant, who is former U.S. Army Special Forces Medical Sergeant and Army Physician Assistant Medical Officer with the 7th and 3rd Special Forces Groups, 82nd Airborne Division, Civil Affairs Command, and the Joint Special Operations Command under U.S. SOCOM. He's currently GW's School of Medicine and Health Sciences Undergraduate Director for Clinical Health Sciences and Health Interventions, also disaster management. He's also a guest lecturer within my Physician Assistant program and our Emergency Medical Services programs. Let's see, in the audience with us we have Ron Waldman, who is president of Doctors of the World USA. He's also George Washington School of Public Health Professor of Global Health, teaching on humanitarian operations and global health and development. He's the founding director of the program on forest migration and health at the Mailman School of Public Health. Was on the World Health Organization Smallpox Eradication Campaign, CDC's Epidemiological Investigations Service principal investigator in the Ries syndrome outbreak, UN Cholera Task Force, humanitarian aid missions, complex emergencies in Yugoslav wars, and the Great Lakes crisis following the Rwandan genocide in the Great War of Africa. He was also principal respondent to the Aceh Indian Ocean tsunami of 2004 and 2010 Port-au-Prince earthquake. Please join me in welcoming our panelists. So I wanted to give each of you an opportunity to present sort of your key ideas that you want to get across this evening and your past experience in working with international aid and development. I guess Mrs. West, we can start with you.
Okay. I have the video.
Yes.
Yeah, I was thinking that. Sure.
So I think I am somewhat of a latecomer to this panel, so if my presentation doesn't quite fit within the rubric, please excuse me. But I wanted to start off by showing a 2-minute video of the work that the American Red Cross is doing in Haiti. This video is something that we prepared to showcase our work on the 40th anniversary of the earthquake.
On January 12, 2010, a 7.0 magnitude earthquake struck Port-au-Prince, Haiti, killing more than 200,000 people, destroying homes, infrastructure, and people's livelihoods, leaving 2.3 million people to take shelter in makeshift camps. The American Red Cross and our partners are helping ensure Haiti not only recovers from the earthquake, but can better withstand and cope with future disasters. So how does it work? We work closely with the Haitian Red Cross, the Haitian government, local authorities, and community members, as well as local and international partners to ensure a coordinated vision for community rebuilding. The Red Cross helps move men and women, the old and young, the healthy and disabled, out of camps, while still caring for those who remain there. The Red Cross is ensuring that Haitians have better access to clean water and sanitation. We're engaging volunteer health teams to educate Haitians about cholera prevention, hand washing, and household water treatment so they can send future outbreaks. The Red Cross works with schools and community youth groups to promote disaster preparedness and first aid training. We work with community members to make decisions and prioritize actions. The Red Cross moves beyond demolition and makes communities safer by creating pathways, and drainage changes and by adding solar power. We're not only safely rebuilding homes and other infrastructure, but we're making communities more resilient by teaching people fundamental skills. The Red Cross supports green rebuilding practices to ensure a more environmentally sustainable Haiti in the future. We help community groups form savings associations so that they and the community can better reach financial goals. The Red Cross supports the building of new hospitals and clinics that offer high-quality medical treatment and train patient medical professionals. In the end, the American Red Cross is restoring and reinforcing communities that can thrive and better withstand future disasters in the years to come.
Great. Okay, thank you. So, as Jeremy said, I'm Sydney West. I'm the Senior Program Officer within our Haiti Assistance Program. I came prepared to talk a little bit about my role at the Red Cross. In my position, I'm in charge of several projects. One is called LAMICA. The second is a gender-based violence project. And the third is called CRCIDA, and that's around HIV/AIDS. But I want to focus on the LAMICA project because I think that's fairly interesting within the rubric of a lot of the work that's done on the ground in terms of development assistance. I think a lot of you will recognize that usually assistance programs tend to be done by sector. So it's usually a health project or a reconstruction project or a livelihoods project. And the LAMICA project is the Red Cross's attempt to form a integrated neighborhoods project. It's made up of 3 pillars, the first being a social and health component. So as part of that, we actually are working with communities on the ground, schools, churches, and we are sharing messages around disaster preparedness, HIV/AIDS, cholera, and just general risk reduction within the community. The second part of the program is livelihoods, and that is being implemented not by us, but through an NGO. And we've engaged 2 NGOs, and we've engaged them to create different systems, different models to provide jobs for people. There's job training for different groups. We also are forming voluntary savings and loan associations as part of the livelihood component. And then the third component is rehabilitation and reconstruction. As you all know, many homes were damaged by the earthquake, and the Haiti itself, the land is full of ravines, very steep slopes, and every time it rains, it just compounds to the disaster that's already occurred. You have houses that slide down hills, you have ravines that fill with water, they're already filled with waste and garbage. So that third part of the project is working on fixing roads, fixing homes, moving people who are living in areas of risk, moving them to other areas. So this is a $20.9 million project, when in the scheme of our entire program is somewhat small. The American public was very generous and provided almost $500 million to the Red Cross for our work. But I wanted to just really quickly tell you about that project because I think it's really unique in the way that we are trying to cross the various sectors. And of course, as a part of that, we've had certainly our difficulties in implementation. Getting the 3 pillars to speak to each other in a sense. Getting our partners who are working on the different pillars to work in coordination. It's caused communication problems, planning problems, but we're hopeful that in the end, 2015, we will have a successful project that we can then share with other groups, other organizations as a model of integration. So I'm going to stop there because I know everyone else has insights that they want to share with you, but I am more than happy to answer lots of questions as part of the panel. And I also brought a fact sheet which explains in more detail some of the work that we're doing on the ground. Thank you.
Shall I introduce you? That's fun.
Oh, you got slides too?
I can't talk without a map. So we've got our official map.
Speak out right now.
Right. When I was in the state, we didn't have audio visuals.
Ooh, you're showing your age.
We generate that.
Okay. Thank you so much. Eileen Smith from the Department of State.
Thank you. So I just wanted to have this up while I talk and just to explain. So this is a map of Haiti that everyone's familiar with, but you can see the areas that are colored in, and those are our development corridors where we are geographically focused on our assistance. So thank you very much for having me today. This is a great opportunity for us to hear from you, and I think with this small group we can actually get ourselves into a nice conversation when we finish with the speeches. We have been incredibly fortunate in the U.S. government to have received supplemental funding from the Congress after the earthquake, and we have been able to use that to focus first on the humanitarian response and then on reconstruction and development in Haiti. We also are fortunate to have the best donor coordination that I have seen anywhere in Haiti. We have a great partnership with the Inter-American Development Bank and the World Bank, and we work frequently together with the European Union and the French and the Canadians. It's a really great environment for everybody working together to try to get things done there. Of the $3.7 billion that the Congress has made available since the earthquake, 2.7 has been dispersed. So this reflects an intense humanitarian response period following the earthquake, and there's debt relief in there and also serious investments in reconstruction and development. It also reflects progress that is not as fast as we or the Haitian people would like to see, because we still do have some money that we need to move out faster. Our program focuses on 4 substantive areas concentrated in these geographic corridors. We work on infrastructure and energy, food and economic security, health and education, and governance, rule of law, and security. And I would like to point out that in terms of health and food assistance, we work also outside the corridors because we want to be able to help vulnerable families wherever they are, and also there's really no point in trying to address infectious diseases in just a few places in Haiti. Also, our police work affects more parts of the country than just the geographic corridors. We have learned a lot along the way, for good and for bad. We have experienced the incredible resilience and optimism of the Haitian people, which is absolutely amazing. I don't know how many of you have gone there, but to see people who have had this much hardship in their lives, and they have these wonderful, they call them tap-taps buses, and they are painted all over them, and they can barely even see out the windshield with their "Thank you, Jesus, I love you," all this happiness, which is just incredible to me for the circumstances that they come from. We have learned that we do our assistance projects better when we build upon what the Haitian people are already doing. And we have learned that we need to do more of our assistance through Haitian institutions and the government of Haiti. This is a key part of sustainability, and it's also hard to do. We have a responsibility to help build up the capacity of these institutions so that they can take responsibility for U.S. assistance funds. Haiti is making progress unquestionably right now. There is economic growth. Most of the rubble has been removed. New buildings are being constructed. Roads are being repaired. There are thousands of new jobs. Exports are up. Agricultural production is up. If you go to the Whole Foods right by here during mango season, you can buy Haitian mangoes, which cost more than the other mangoes you'll even find in the same store. Haiti is undergoing right now a peaceful political process to get toward long overdue elections. This is fabulous news for Haiti. There is a new source of reliable electricity in the north. Health statistics are up. And the Haitian National Police have professionally dealt with demonstrations. They broke a dangerous kidnapping ring last year and have added 2,000 new recruits to their force. These are a lot of successes that are happening in Haiti. However, we have also learned that we are on a long-term journey. Haiti had its challenges before the earthquake, and if Haiti continues to make good decisions, it will still take another 25 years before Haiti becomes a middle-income country. The challenges are enormous, and the solution is not going to come overnight. Things Haiti needs to work on: they need to improve their investment climate. They need to pass a number of laws that are waiting either in the Council of Ministers or in the Parliament. There's a new criminal code that needs to be passed that will help in the process of freeing thousands of prisoners who are sitting in pretrial detention, some of them for many years. They need to reform the energy sector, and they have got to hold elections this year. It is absolutely crucial. There are challenges on every single level. But there's also great interest in Haiti. Among the American people, there is a lot of support. Pretty much every community has a church group that is going down to help. Every flight I have been on, and I go down there a lot, is full of missionaries, people with their matching t-shirts going down to help for a week or 2 weeks or longer. There is a lot of commitment among the American people. About half of all American families texted money to help Haiti after the earthquake. There is strong bipartisan support in the Congress, and there is an energetic diaspora. With all of this, we are making progress together with the Haitian people and the government of Haiti. It is slower than we want, but we are getting there. And so I would love to hear from all of you, get your thoughts on it. Thanks.
Next up, we have Ambassador Charles Ries.
Thanks very much, Jeremy. I'm not going to try to have as long as my introduction. Let me just say a couple of things. First of all of us who've ever had anything to do with Haiti, it kind of captures you. My first exposure to Haiti was when I was a junior officer in the Foreign Service in the 1970s. I was assigned to the Dominican Republic and visited Haiti a number of times then. And it kind of gets to you. And in a sense, I should explain a little bit about RAND. RAND is a nonprofit research institution, think tank. And we decided in 2010, right after the earthquake, we had done a lot of work on nation building around the world, and particularly in post-conflict situations. And the thought was maybe we ought to take a look at Haiti after the earthquake, and with the idea towards being helpful. We produced a book that year called Building a More Resilient Haitian State. And the RAND Review is a sort of a popularized version of the conclusions of that book, which I'll let you read. I don't have to really get into. I then, after being part of that team, was asked by Gary Edson and the board of the Clinton Bush Haiti Fund to help steer the initial efforts of the Clinton Bush Haiti Fund, which had its own source of money donated by Americans to try and make a difference in Haiti. And so in that year, I spent a lot of time on that American Airlines flight from Miami into Haiti and spent a lot of time thinking about the problems. I would just say just a couple of things to conclude, to capture what the insights that we had then. And that is, and I'm delighted to hear Eileen talk about the priorities we're doing now, because Haiti has been, in a sense, blessed by the concern of its neighbors, the concern of the United States, the concern of the Europeans, but also imposed upon by that. The assistance that has helped Haiti over many years has indeed helped deal with health and other problems. But it is also, plus other characteristics of Haiti's history, have weakened the Haitian state and state institutions in a way that has made it difficult for Haiti, the country, to be as resilient as Haitians the people are. And so the thrust of our book was to make sure that in the huge effort post-earthquake, that donors not weaken patient institutions, in fact, take steps to utilize them and to strengthen them, to ask more from patients. And Eileen well summarized what it is that the United States government has been doing, and I think that that's very good. One of the controversial, shall we say, proposals in our study was that it be the NGOs and donor-assisted funding actually not be exempt from taxes. One of the problems when you have an economy where 40 or 50% of GDP is represented by donor funding and by NGO sort of charitable contributions is that the state has no source of tax revenue. It's hard to establish a decent state if you don't have revenues to do that. Many other problems. The Haitian judicial system is a mess. Glad to see that there is progress towards addressing that, dealing with the child detention problem, which is a human rights disaster, among other things. The economy is remarkably resilient given the problems. Property records are bad. Commercial reports are bad. It costs more to establish a business in the poorest country in the hemisphere than almost any other country in the hemisphere. There are a lot of burdens that Haitians face. So deregulation, ease in establishing businesses, attention to energy, attention to ports and transportation, all these things will really help, and it's clear that they're doing them. I guess the other thing that we focused on was the idea of priority setting. And it's kind of hard now in the distance from the earthquake almost 4+ years ago. But at the time, Haiti and the international community got McKinsey to come down and work with the Haitians to develop essentially a wish list for the international community and the donors conference that came for the $5 to $6 billion in assistance that they expected to get. And one of the problems was that it was, as many such things are, a kitchen sink report. Everything was in there. And when you have an institution with a situation like Haiti with limited capabilities of the state, huge problems in the very, very short term, health problems, the cholera, the rubble, and everything else, there was no clear sense of priorities. And one of the things that we've learned from other state building efforts that we've done elsewhere in the world is that governments can probably only manage, a host government in a poor country can probably only manage one or two major priorities in each sector. And it's important for donors to come from big governments with well-established public administrations not to impose too much help. The government focus on addressing the first most important problem first, and second most important problem second. And that's one of the other main thrusts of our report. But it's clear that Haiti is on the up and up, in part because I think this time donors understand the importance of coordination and understand the importance of helping the Haitian state develop transparent and reliable rules of procedure and activities, and the importance of grounding the initiatives in law and in political practice so that they are sustainable into the future. And that's the secret, I think, for Haiti. And have Haiti basically take advantage of this horrible tragedy to set itself on a longer term trajectory for growth and development in the future. Thank you.
Next up, we have joining us Nadia Volchansky.
Good evening. Okay, so my perspective this evening is slightly different. It's more of an academic perspective. We have a project that originated with the Graduate Studio a couple of years ago, a few years ago actually, and it demonstrates classic design thinking, design approach to problem solving, or design problem solving thinking. So we presented our students with a need in Haiti. This was pre-earthquake, and the need was specifically women's healthcare in rural settings of Haiti. And our students did a lot of research and tried to understand the setting and different forces that influence or got Haiti to where it is specifically in respect to healthcare. And they came up with first generation of a response of physical facilities that could serve as a model for healthcare infrastructure. The design was recognized by the healthcare community very well. We received an international award for innovative healthcare environments. We were able to present the project to Madame Preval, who was the first lady at the time, first lady of Haiti. It was embraced by the Haitian embassy here in DC, and we also received a seed funding from the university to continue this work and try to implement it. So the second generation of our effort grew to be a much larger effort. We also continue to embrace students and in fact energize students, and it is primarily student-driven or academically driven initiative. It's called Down Haiti, and what we have done with that in the second generation is try to identify key members of local and international community that need to be present at the table in order to make to envision a very culturally sensitive, demographically sensitive response. In fact, I would go beyond saying sensitive and perhaps saying compassionate, because we wanted to make sure that the community is involved, that they are very much a part of every decision that we're making, that we are considering natural resources, we're considering common practices in rural Haiti. And so when you're dealing with so many different forces, the process becomes slightly elaborate. So what we did is use, again, a classic design approach. It's called a charrette, and what happens during a charrette is all the different stakeholders for a development project come together to the same table, and we try to brainstorm collectively, which becomes a very dynamic process. For us, it took 2 days. We had representatives from the Haitian government. We had a Haitian NGO. We had Project Medishare with us, who was identified as the operations partner for this potential clinic and provided the site. We had local architects, engineers, sustainability experts, political figures, obviously students were a big part of this. And in 2 days, we were able to come up with what you can barely see on the screen. It's a prototype of a very flexible facility. So if you can see in the yellowish image, instead of having one centralized facility, we decentralize, and each individual pod would be holding a separate function of the clinic. This was a much better way of constructing facilities in Haiti, specifically because of earthquake and hurricanes. It also allowed benefits such as natural ventilation, and etc., and allowed a community-centered aspect where during the day it would serve as a clinic, but in the evening the courtyard and some of the parts of this facility would be used for community events. Anything from students being able to come and use the energy or the electricity to do homework in the evening, to having community events or training programs, etc., for the community. And then this was the envisioned design from the clinic. So the couple of things that I'd like to note is, first of all, again, it was the process with which we did this was very unique and very interesting, and it allowed us to consider many things simultaneously. So all the decisions were being made at the same time, and layout of the buildings, individual pods, was considered at the same time as measure ventilation as an example. So we were able to figure out, the topography and how the air was moving, coming in and going, and where you put the exam rooms and patient areas as opposed to secondary facilities and such. So it's a very informative, very good process, and in fact, it's being suggested for development projects as the process to use to come up with these responses. And today we are still in the fundraising phase for this project. We have applied for a couple of grants. The response to those was that we needed more training, and the clinic was designed with the intent to introduce not only a singular facility on the patient landscape, but to have that facility be embraced by the community so that they'd be more protective, which would ensure the longevity of its operation. For that reason, we identified a partner who would be operating that is on the ground, that has been on the ground for many years, and would be able to continue to energize the community around this. And so since then, we actually we're working with the development community and other nonprofits in the area to bring in construction training, so that local community would be trained in construction practices to A, help us construct this clinic, but B, then take those practices and implement them to other construction in the area. B, medical agent training, public health programs and other programs, so that this wouldn't be just a clinic, this would be a community center that would hopefully bring revitalization to the entire area that this is going to be affecting. All right. I think that's it. I would love to answer questions. Like I said, we haven't implemented the clinic yet, but we have a lot of very interesting dynamics that came into play to shape this collaborative. Thank you.
Joining us next, we have Mr. James.
Okay, so now all the smart people have spoken, and now you're stuck with me. My name is Jay McGinnis. I just recently retired from the Army. I retired in August of 2013 after serving 26 years. My perspective, I hope to bring to discussion, is what role does the military play? What assets can the military bring to bear to be of assistance in these types of events? Like I said, there's just my background to sort of frame the discussion and help you kind of direct your questions in the right direction. I spent 26 years in it. The vast majority of them spent in special operations. People think about special operations as the guys who go down doors after bad guys, but that's only one element of what they do. There's a whole other element of the special operations community devoted to nothing but civil affairs and humanitarian outreach that is referred to as the Civil Affairs Command. The vast majority of the Civil Affairs Command lies within the United States Army Reserve System. There are 2 brigades now on the active duty side, but the vast majority of that manpower lies within the reserve system. As part of that system, I left active duty for a short period of time before 9/11. After the events of 9/11, I stayed in the reserve system and was mobilized several times before I decided to come back on active duty. And during one of those mobilizations, I worked with one of those reserve units, the 478 Civil Affairs Battalion out of Ries, Florida, where we went to the Horn of Africa. We were based at Camp Monier in Djibouti, and we conducted humanitarian outreach programs pretty much up and down the Somali border from Kenya through Djibouti and into Ethiopia. After that, I went to Fort Bragg and became an instructor in the Civil Affairs program. So that's where some of my information is coming from. That's the background I'm bringing when I chat with you about what the military does. The thing to remember about Civil Affairs is they are manpower light. They're a typical team individual team is 4 people. Those 4 people aren't going to build many schools. Those 4 people aren't going to cure many diseases. But what those 4 people do is they engage the local community and link the community with the NGOs and utilize the things the military does do well, which is move people and stuff over great distances and do it quickly. They leverage that. And then they can also bring to bear Title X funds, primarily in the realm of HA and HCA, HA being humanitarian assistance, HCA being humanitarian civic action programs. And there are nuanced differences to the two. And the last thing I'd like to mention when it refers to the military is this is a little known benefit of the military. I have sat in on a couple of discussions similar to these here at GW, where students are working projects and they have all of the whatever it is that they're trying to get into a given area of conflict. They have it sitting in one country and they can't get it into the country because of the cost of transport. And there's a wonderful political tool called the Denton Amendment. And the Denton Amendment allows the United States military to move donated goods at no cost. And the Civil Affairs Organization is really, really good at bringing that Denton Amendment into play. The last group I spoke with, they were trying to get some medical supplies into the former Yugoslavia, and it was stuck, I want to say, somewhere else in Europe, and they couldn't get it there. It's a very simple thing for the U.S. military to do. There are challenges, though, working with the military and the NGOs. As you can imagine, the NGO culture and the military culture oftentimes clash. So when you get those leaders together, there are often different approaches to problems. The governmental organizations, the non-governmental organizations, and the geographic combatant commander oftentimes have different goals. They may have the same in-state goal, but the pathway to get there is oftentimes a little convoluted. And this, I don't think, is unique to the military. I think it's kind of ingrained in our government. We oftentimes want to very quickly apply quantitative measures to assess what is essentially a qualitative problem. Not that we can't measure qualitative outcomes through quantitative measures, but the classic case is in the northern regions of Afghanistan, we actually lowered the subterranean water table level because we drilled so many wells. Wells are relatively easy to drill, and they're very easy to quantify. And I just use that as an example. So thus ends my kind of background of who I am, and I think all of us are looking forward to seeing what kind of discussion we can get moving forward here.
So at this time, I just wanted to open up to a question and answer. If you have prepared questions for panelists or something you want to share. Great. So we have a couple of questions from our viewers at home. Address the issue of the saturation of NGOs doing isolated work. How do we get more organizations partner with the government and partner with other organizations or NGOs to work towards regulation, coordination there, coordination here in the U.S.?
I'll try that, I suppose. I mean, I think every country has to find its own solution to this problem, but there are pernicious effects of not sort of from major NGOs like the Red Cross or Doctors Without Borders, but in a place like Haiti, which you think Porfirio Diaz, who was the Mexican dictator in the late 19th century, had this epigram which he used to describe Mexico's state, which was "Pity Mexico, so far from God and so close to the United States." And one of the problems that you have in Haiti is that it is close, and it is possible for church groups in Texas or in Minnesota to basically have their own independent and uncoordinated assistance effort in Haiti, and it's a great thing. I mean, it represents American volunteerism at its best, but it does have pernicious effects in Haiti. I was often struck when I rode the American Airlines flight into Port-au-Prince from Miami, and there were all of these very committed, idealistic people with the T-shirts going off to Haiti. You'd say to them, the person next to you in the seat, "Well, you're going to Haiti on mission?" "Yes." Have you been to Haiti before?" "Well, no." "What are you going to do?" "Well, we're going to build houses." I say, "Really? How long are you going to be there for?" "A week." "Are you a plumber, or electrician, or carpenter?" "No, I'm just going to do whatever they tell me to." Then you get into the details, and this person in, say, Colorado has paid American Airlines $1,000 for a round-trip ticket to Port-au-Prince for a week. They have a local sponsoring organization that gets $300 to put them up in a dormitory. And so you're in $1,300, $1,500 say for a week's worth of work. Now, if you hired a Haitian carpenter, $25, $30 a week would get more house built. And the thing is that the $1,000, $1,500 goes to all of these very functional enterprises, American Airlines and the host entity, that are now completely committed to, in a way, the least most effective way of building houses in Haiti. If that's what you wanted to do, be much better off in moving $75 to hire Haitians to build the houses. And somehow you kind of have to get a handle on it, because it's distorting Haiti's economy. Haitians are very entrepreneurial, and they respond to the incentives, and so they offer this, if you will, development tourism opportunity, but it actually is not probably the best way to obtain the housing that you want. But that can't be imposed. We as a country can't say, well, this group in Minnesota, they can't adopt a Haitian village and build houses for them. This is, fundamental to our concept. But it comes with the idea of accepting the fact that the Haitian state or some Haitian political structure should get a handle on this. And our approach, Eileen may correct me, but our approach traditionally has been, this is a great thing. All development, all assistance is a great thing. And ambassadors, some of whom have been my friends, go into the foreign ministry and say, this, school project funded by this NGO in Minnesota ought to have a tax exemption. They ought not to have to pay Haitian Social Security taxes on the people working for it in Haiti. They ought not to pay tariffs on the things that they bring in. These are donated computers. Why should they pay a tariff on a donated computer? Well, the reason is because otherwise Haiti has two economies. It has a private economy that struggles to compete with the donor economy. And that's probably not a good thing.
If I could just jump in on that, I appreciate revenue generation is one of my favorite topics, so I'm glad to hear you raise it. In Haiti, they actually are trying to get a handle on the NGO tax situation, and part of me says, oh, this is going to discourage donations, but the other issue here is that some businesses are coming in getting an NGO registration in order to avoid the taxes.
Distorts the whole economy.
Yes, it is distortive. I would say that Haiti only collects about a quarter of the customs that are due to them, and doesn't collect most of what the large and medium taxpayers owe them. So even before they need to go after donor assistance taxes, they need to go after their own. And we are trying to help them with that, but that also requires some political will that is not forthcoming right now.
Oh, I do have. Go ahead.
Back here was the first one.
Yes, Dr. Paul.
Thanks, Sharon. I just wanted to add two things. I really endorse the ambassador's comment, particularly the one regarding curse of Haiti, one of its curses being its proximity to the U.S. I served as the U.S. government's representative coordinator of the health sector in the immediate aftermath of the earthquake. And it's very hard to get things done when 350 organizations sending physicians, nurses, physicians assistants, acupuncturists, and there's acupuncturists without borders, it's difficult to develop a strategic approach in an acute setting like that, and maybe even more so in the longer term developmental process. So I think that is certainly a problem. It's a problem not only of number, though it's also a problem of competence. And no matter what systems are worked out that seem to be well organized and well coordinated and well structured, if the work isn't getting done in the highest quality manner, in the end, it's not going to happen.
Right.
And Haiti has also suffered from a lack of confidence in development prior to the earthquake, decades of that, and now to some extent afterwards as well. I think we've heard a lot about money being, a lot of U.S. money being in the coffers of the contracting community side, but also I wonder what proportion of you give us some numbers as to the proportion of the U.S. government relief funds that actually ends up on the ground helping people, at least in quantity, if not quality. But I really wanted to ask one question that bothered me a lot when I was in Haiti, because the earthquake had a much more devastating impact being in the capital city than many other disasters had in other countries. And I wonder if anything's being done to decentralize the state to some extent. Haiti, when I was there in 2010, and I had been there many times for many years prior, had this tendency to move towards a situation where they had one of everything and it was all in the same place. You know, the tertiary care hospital, it was important. The international airport, it was important. Everything in every sector, one of it important. And it didn't used to be that way. There used to be different regional centers. So I was a little bit intrigued by your map of the 4 corridors. I wonder if you could say a little bit more than that, because when I was there speaking to Haitians, these people come from the outlying areas of Port-au-Prince, just as so many people from Port-au-Prince fled in a way to their ancestral home, so to speak. And there were many, many stories of people being able to go from Haiti to Europe or to the United States without ever transiting, because they were from Cap Haitien, there were ships, there were from Jacmel transport, and there used to be a much more vibrant trade, much more vibrant communications with other, with the rest of the world. So when Port-au-Prince went down, it was even more paralytic than it might have been under other circumstances. And I was wondering if that was part of the reconstruction of other centers of commerce and activity.
You're absolutely right, and thank you for raising it. So now I'm really glad I brought my map with me. The corridors are an active effort to create economic centers away from Port-au-Prince. As you state, probably maybe 80% of the 10 million people in Haiti, I'm not sure about 80%, are in Port-au-Prince. And they came because there weren't enough resources for them where they were. And then the impact of the earthquake was even worse than it would have been. So certainly in the north, we are trying to create a new economic center together with the Inter-American Development Bank and the government of Haiti. We have created the Caracol Industrial Park, which should within 5 years create 20,000 new jobs and has the capacity to hold 65,000 new jobs. There are already 2,500 new jobs there. And so we're trying to create a growth corridor there and also focusing on the Sunmark corridor for those exact reasons. We also have a local government decentralization program that is designed to strengthen 10 local governments, but not just the governments, but also the civil society in those areas, so that both the government and the people will be better prepared to work together on budgeting with the focus on encouraging people to pay their taxes, understanding that they're actually going to get something back for those taxes. Yes, and thank you for raising that.
Yeah, and I want to sort of circle that back around to this. And I thought that your characterization of the perniciousness of this involvement is spot on. But I want to circle it back around to that. What we're seeing a lot of, and I can't speak specifically to Haiti, but I kind of keep my finger on this whole disaster response, humanitarian outreach from the civilian sector, and this new thing called volunteerism is coming out. And that's the cool thing to do now, is to take your 10 days of accumulated leave and go to some destitute location and volunteer to do some good. That's a wonderful concept, and I don't want to discourage that, but there's only so much you can do in 10 days. And when the primary port of entry is the one city, and it's going to take you another 2 days to get to the outlying region, I mean, these people are going to do the most they can in the shortest amount of time that they can, and building in a day or two of transit to get to the location on the day in, another day or two of transit to get out, shortens their, for lack of a better term, ability to feel good for the entire time that they're there. And then the other thing that I wanted to bring up is that, and again, the curse of being close, it's also the curse of being very well publicized. There are thousands and thousands and thousands of other countries going through similar types of difficulties. They don't have the publication and the popularity. And that's part of what leads to this influx of well-meaning, but perhaps not well-executed NGO efforts. And there is the danger that I see, and we've seen it, a guy whose first name I can't remember, he's an author, not Henry David Thoreau, his last name's Thoreau, he's a travel author, wrote a phenomenal book called Dark Star Safari. It's very easy read. Paul Thoreau, thank you very much. Very, very easy read. And we talk about this in this book. He talks about this business of humanitarian relief, and it becomes almost an economy of its own. Mm-hmm. And we have to remember that the objective of this is self-sustainment. We don't want to be there 20 years from now. We really don't. And I think that's a really hard thing to communicate to, again, some of these well-meaning NGOs that are in for 10 days or in for 30 and out again. It's a challenge. How do we break that cycle? I think through education. I think through things like this. And I think that there's as much of a governmental engagement with the NGOs as is possible, both before and after their initiatives. That's my sad and dark.
Can I just pile on, because it's not only NGOs and volunteerism. Governments also have a role to play. When we were doing our book, we went to visit the Secretary General of the Prime Ministry, who was in charge of public administration reform. This was like right after the earthquake, and of course, there was a tremendously horrible earthquake from the standpoint of public administration, since 18 ministries fell down, and all of the effective bureaucrats were the ones who were there at 4:30 or 5 o'clock in the night, so it decapitated the Haitian system. But so as part of our book, we went to see this fellow, and I said to him, well, could you summarize the donor assistance you have in public administration? He said, yes, well, the EU gives us $1 million a year for a new public employee sort of classification system. And the Canadians have a program, $1 million too, and it's for monitoring evaluation. And the USAID has one, and the Spanish have one, the French have one, and there were like 8 or 9 different separate $1.5 million assistance programs dedicated to public administration that were under this guy's oversight. And total $10 million, $11 million. I said to him, gee, that must be a really pain in the neck. All these missions of all these, all these donor things, and some are in French, and some are in English, and some are in Spanish, and they all come down and want your time. wouldn't you rather have just one donor giving you $12 million rather than 8 or 9 donors giving you $1 million? And he looked at me and said, "Are you completely crazy?" He says, "Oh, I'm sorry. We're a poor country. We don't have the opportunity to choose. And so we take money wherever we can get it. But what happens is that the 9 or 10 donors jerk around with 1 or 2 effective Haitians, and they spend all their time dealing with these donor requirements in a workshop in Nassau and a special report, and the minister is coming, you've got to meet with them, and they chew up the effective people's time. And in a sense, it's the same phenomena. Every CETA and USAID and the EU and the World Bank and the UN institutions, they all want Haitian programs because Haiti's poor and high profile and so forth, but they don't have lots of money, so they cut it up in little tiny bits and pieces. And so in the post-earthquake effort to establish an effective donor cooperation program, one of the ideas, which I think has been half realized, and Eileen can tell us for sure, was to try to get donors not to step on each other. And, everybody has a public administration, everybody has a health program, everybody has an education program. So that among other things, you don't duplicate and have these programs that are incompatible. That, it's a tragedy because the really scarce commodity in Haiti are Haitians Haitians that are effective at delivering, honest, transparent government. And if those people spend all their time dealing with the foreigners, they're not doing their job.
You raised 2 really good points that some personal experience comes to mind. You referenced this duplication of effort and the need to engage the local, and I personally would limit it to the local government to kind of take some charge of it. But we went into Ethiopia, and the command had heard that there was an issue with polio in Ethiopia, and so the command's idea was that we would go in with all these polio vaccines and start doing, and on the surface that sounds great. And I think part of what happens is the idea forms remote from the problem. And because that idea forms with a lot of financial backing and it becomes an agenda item, it winds up on, somebody's mission priority number 4, PowerPoint slide number 3 on the weekly brief, it must move forward. Well, when we got on the ground and started asking around, there was a very robust polio vaccination campaign already in place. And so, again, well-meaning, but you run the risk of over-immunizing from a medical perspective and over-treating from a medical perspective. And the community's not going to turn you down in rare cases. And then the other story is we were working in northeast province of Kenya in the town called Wajir, and looking at a hospital, we were looking for things that we could do for them, and we had some money we could spend, and he wanted us to get him a new ambulance. And so, well, I don't think we can get the money to buy you a new ambulance. What's wrong with the one that you have? And he takes me out back, and there are 4 separate Land Rovers, each Land Rover donated by a different entity, and they're all sitting on blocks. And I said, you don't need a new Land Rover, friend. You need a mechanic. We need to find somebody in the town that wants to be a mechanic, that we can train to be a mechanic, that you can then fund to be your maintenance guy for your ambulance service. And that's sort of it's just the cycle that we get in. And I don't know how to break it, but it's a cycle.
I think that perhaps the question then turns to not the centralized government, but localized government. And when we're specifically we're talking about decentralization, there's a huge effort from what I understand in the Haiti to decentralize, right? At least when we were working with the nonprofit that we partnered with Project Share, we went through the local government and tried to understand what their needs are, because they know the standards, they know the practices, they know the needs of the local communities, and to coordinate with them, it's much simpler. You don't have to go through a lot of through multiple layers of offices to get through to get an answer. And so, especially when things like that happen, they know what needs to be done in their community, and they also communicate with the centralized government. So at least from that perspective, I think if we were to work with the local community, it would enhance it would strengthen decentralization, specifically in Haiti.
But it's like that's where the planning has to happen, and I think so much of what happens at the GO and the NGO level, military level, is the planning starts back here. I think the planning needs to originate here.
Right, and there are things that are necessary that no one wants to do. In 2010, no one wanted to do rubble removal. They go like, oh, we don't want to go to Parliament and say we spent $100 million on rubble removal. And it was for 6 or 8 months. It was a huge problem. No one wanted to do rubble removal. People wanted to do health. They wanted to do education. They wanted to do something you could take a Codel to see. And the rubble removal is gone. It's sort of like the rubble's gone. And so there's nothing to look at. And that was a problem. And it's another manifestation of the same characteristic in which donors choose the areas to get involved in based on their own, economists would say, objective function. What it is that motivates their board of directors or their chain of command. And the only, I think, reasonable antidote to that is to strengthen the local governance, the local provincial governance, to help them understand and help them have resources that they can reach back to Haiti, but not donors, because donors have a conflict of interest, and it has to be, you have to strengthen the institutions of local governance so that they can say, we don't want another broken ambulance. Or another ambulance that we run until it breaks. We basically need support for a maintenance program. And probably you will find donors are always more willing to give you capital goods than O&M money. And that's true everywhere. We had that in Iraq. When I was in Iraq, I ran $2.5 billion of assistance. And I asked Washington for $100 million for an O&M fund, because the Iraqis weren't maintaining anything. And I said, I will use the $100 million in matching things. So I'll go to the Iraqis and say, if you put in 50, I'll put in 50 to do an O&M program for the roads or the schools or whatever it was that we were working on. Washington said no. And, well, why not? This obviously makes sense. And they said, well, Congress doesn't like it. They don't want us giving money for ordinary operations and maintenance. It's got to be something that we build. And so we bear some of the responsibilities for that as well.
I just want to add, I'm sorry, without painting too bright of a picture, because there are challenges always in donor coordination, but I want to commend the government of Haiti for creating the CAEB. It's a committee for coordination of development. I don't remember what it stands for in French, but it's an economic assistance coordination committee, and they have the sectoral tables where all the donors can come and talk about what they're doing in this area, and they have twice a year national level meetings with the leadership of the organizations in the country, and then once a year bring in people from capitals to talk about what they're doing. And there has been pretty good division of labor, as in the European Union has chosen these roads, the World Bank is doing these roads. In a number of cases, there are similar programs by different organizations, but there is an attempt to spread them out geographically or by sector. So it is not perfect, but the effort is being made and is being led by the government of Haiti.
I was just curious, you guys have talked about some of the barriers that are occurring with this, but what does the effort look like to transition this at the government and private sector level to agents to take over these responsibilities so there's more, like you said, we can't be there forever. What does the effort look like to train a workforce and how the workforce that is eventually go effort?
Can I jump in? Yeah. So the Red Cross works, one of our key partners is actually the Haitian Red Cross. And we are working with them at all their different levels. Their main office in Port-au-Prince. We also work with their local offices all over the island. And we're working to build their capacity so that when we leave, they can run the same functions that we do. And that includes everything from providing capital for them, providing training for them in different areas, and actually sort of co-managing projects with them. One of the problems we have found, though, is that I think almost that we're trying to move too quickly. And they can't absorb all of the money, and they can't keep up in terms of all of the projects that we want to implement. So it's very difficult for us in terms of, as a donor, we want actually to help as much as we can, but when we try and the more we finally go and dig at the community level, actually the slower our work becomes. And that's a real...
And I think the ambassador tapped into this cycle that there are people there who would love to receive the training. They want a job. The donors and the people on the ground are there willing to put that person to work for that project. At some point, the government is going to have to be able to gain its own revenue. So the government becomes the employer of this newly crafted technician or skilled tradesman. And I think that's another one of those, it's a dilemma that, I don't say it's unfixable, but it is just something we need to be cognizant of.
And just really quickly, the Red Cross, we also, the same thing, we try and do capacity building with NGOs. And again, we're trying to move at a speed at times and trying to fund them at a speed that it causes a real dissonance. I mean, it actually causes more friction than we would have liked. So but we don't really know what the answer is to that.
So there are a couple of ideas sort of tossing around in that. One is with the multiple NGOs that you have implementing these projects. Some of the things that you saw in the field was a problem with crosstalk, where the native population is getting 4 or 5 disparate messages, for example, on how to effectively clean water. And so they get, a list of 5 things to do, but they get 5 different lists. And so by the time I show up and do a household survey, none of them are following any of those. They're following a piece here, a piece there, and it just sort of all flows together. So I guess part of the question is, how do you effectively look at the community that you're working in terms of who else is operating around you? There are so many actors in that theater that it's sort of difficult to keep track of who's doing what. That would be one. And I guess the other one we were talking about is how to rebuild infrastructure. The problem with monetary policy and without a tax base, how do you rebuild that infrastructure? So the issue that President Martelli had with his education program, for example, where he wanted tax remittances going back to Haiti, and it became a huge political football that was tossed back and forth by the Haitians. But that was the tax base that was available to him because none of these NGOs are getting taxed along the way. So, how do we balance that scale?
It's incredibly difficult. In some of the projects that we're implementing, say in housing, we discovered that a couple of NGOs are giving different models in terms of what are some of the best practices towards building homes. And so before we implement one of our key projects, we're actually thinking about aligning. We had our own, we were about to fund an NGO. We were going to ask this NGO to go back and see if they can align their checklist of the best practices for home building with the organization that sort of piloted this first manual. But no one coordinated this. It's something we came upon by accident. And so that's not great. From my perspective, I think it would be great if I would love to see more coordination by the actual governments in terms of, okay, we know 5 donors are coming in to work on X, Y, and Z. Even if, can we at least get ensure that we lock them in a room and they coordinate their programs. You know, it's like we won't let you implement in our country until you have at least sat down with the 5 other actors who say they're going to work in the same neighborhood or implement the same project.
I'd even go further. Because, in a sense, if the 5 NGOs coordinate and they divide up the country or the sector or whatever, you're dealing not then with a monopoly. If you're the patients, you're dealing with an oligopoly. They say, okay, this is it. We've divided it up. It would be better if the patients had the self-confidence to say, you're going to do this, you're going to do this, you're going to do that. And the Spanish say, but I don't want to work in Capetian. I want to work over there. And at that point, the Haitian government needs to say no. And a Haitian government that says no, it's going to, it doesn't have to do it very often, I suspect. Because if you only say no once or twice, then somebody realizes that you might, and then you have much more negotiating power. And that would be really the best. But to do that, the state needs to build the capacity and to be able to recruit and retain top-notch professionals. And so that's where public administration reform comes in. That's where the tax base. The things are all interrelated. But merely getting the either the NGOs or the official donors to divide up the country doesn't really get it to be answering to the Haitian priorities. There are
models where it's succeeded, at least in the health sector, beyond anyone's wildest dreams.
Right.
Not exactly a dividing of the country, although that's what changes, but there are ministries of health, the 2 most notable are probably in Afghanistan, and you see that really, and in Liberia, more there, and in the 90s, where ministries of health, albeit weak, were strengthened by foreign donors.
Right.
One is the United States, and others, United States, USA, they stood on the side, but the World Bank provided the strength, where the governments developed a system where all they said was that they wanted to be stewards of their health policy. They didn't have the horses to do the implementation, but they dictated the terms, and they did it on a contracting basis. And they contracted out the NGOs and said, here's what we want you to do. We're going to give you the money that we're getting from a donor to pay for it, and you just implement it. We'll monitor your work, we'll evaluate your work, you fulfill the terms of the contract, or you leave. And I've been in meetings with ministers of health where they've told the representatives of the NGOs, you're not satisfied with the work, you haven't fulfilled the terms of the contract, we're letting the work at the contract out to another organization. Goodbye.
That's
it can be done if there's a will to provide support to the government and a will on the part of the government.
Through Rwandans also.
Here, but in Haiti, for some reason, one reason or another, the support's always gone to those who were not, for various political reasons. So I just want to back you and say it can be done.
Yeah.
And if they're well documented, written up examples of success in both of those countries.
In Haiti specifically, in the construction industry, the Ministry of Tourism and Construction was developing some standards, some building codes. The problem that we understood was that they were not being enforced. So they were in place or were being generated, but the local governments were not enforcing them. And so everyone was coming in and building things, and nobody was checking how they were built. So then is the burden on us coming in and trying to work with the local nonprofits in Haiti to make sure that we comply. But if no one's coming down to check, and then 9 times out of 10, we don't take the initiative to go, right? So when we were working, we were very sensitive to make sure that we did have a copy of this, whatever standards we had, they were very, very, very loose. And they need to be defined apples to oranges. But that's what we found was the bigger problem. Not the fact that they weren't taking the initial steps to dictate how this should be, that they weren't enforcing that and following those steps.
We also had instances where 2 sets of guidelines were authorized. And so, and another issue that we've come across is for instance land tenure. We have two sectors of government saying they're responsible for parcels of land. So one group says, no, we have the authority to actually sell this land, and then another sector of government says, no, that's under our authority. So.
Right. Well, the cadastral system, the system of land records, is what I would consider to be a very high priority for fixing. And it's been, there have been international donor programs on cadastral records in Haiti for 20, 25 years. They just haven't succeeded. For one reason or another, they were too small to the problem. They were quickly corrupted by special interests. But that is a high priority. The business registry problem is really, it's amazing. It's a country where in order to establish a legal business, you have to have the capital equivalent, if I can recall this, it's in our book, but it's like 3/4 of the per capita annual income. So it's as if our per capita annual income is $34,000. It would be, you couldn't establish a business in the United States unless you had the equivalent of $25,000 in cash. Now, there would be lots of people who could still establish businesses in the U.S., but in Haiti, where resources are very short, the result is that almost all the businesses are illegal in that they have no legal standing. And so they get jerked around by inspectors getting payoffs and this, that, and the other thing. The simple thing to do is make it so that, it costs you $15 and, you get a certificate and you can set up a business so you can legally sell apples in the street. And this is not unique to Haiti. The whole Arab Spring started over essentially an unregulated food seller in the street who was being jerked around by the authorities because he had no standing. And part of the, insights of Hernando de Soto and all these other analysts of development is that you have to start with property rights, and you have to start by making it simple to be legal, because then the authorities can't exploit their power of discretion over the individual in order to suck all of the benefit of economic activity. And these are the things that are really fundamental. And at least the insight I would think that you would want, in addition to a lot of the issues we've talked about in Haiti and the problems of NGOs and the problems of governance, are to be really keen to prioritize. I'm very impressed with Tom Adams, Eileen's boss's conviction very early on to do this Caracol project, because it's a priority because it gets the focus away from Port-au-Prince. It opens a new port. It is a node for improved utility, water and power in this region, and it is exactly the kind of thing. So what's the most important thing? We're going to do that first. We're going to understand that we can't necessarily also at the same time fix Jacmel's power. But it's okay. You can't do a little bit of everything. It's much better to do one thing in a sector right than to try to kind of salami it out. And that's how countries like Haiti actually break out of the development trap that they're on. And it's not a democracy, but Rwanda has really taken that approach to economic development. It's one of the best performing economies in Africa, because they really were pretty ruthless about deciding what was important to them and doing that first.
Yes. If I could bring it, this has been a wonderful conversation. Let me just bring it home to this group here. Because as I look about this group, at least half of us have been down to Haiti or going to Haiti for the next 6 months. George Washington Medical Center does sponsor trips to go down to Haiti with Project MetaShare, and we've been doing it now for 8-9 years. Every time we go down there, we have in the very informal discussions that you're having right here, which really is what the hell are we doing? Are we accomplishing anything? Are we making things worse? We're stealing resources from where they could, local people could use their time more efficiently. Are we helping or are we hurting? Each trip costs about $40,000 for about 20 of us to go down, including American Airlines, which is a big cut. And I often said, dream that we go down in a nice Toyota SUVs, taking the $40,000 and just kind of tossing it out the window and letting them, if
Figure it
they
out.
get it, build their house and buy the material. So my question is the expertise of this group. George Washington University is donating money for these trips, is participating. The university, I think, is a lot of, as you're saying, they give publications, they take nice pictures. They're getting an education from them. People that go down, nothing to sneer about that. People going down get educated about developing medicine, what things are like. But the real question is, what good are we doing down there? So the question to the group is, if you're a nonprofit, a university, an NGO, what do you look for to make an impact when you go to some place and try to do good? Who do you partner with? What do you look for? How do you critique your ability to actually be of assistance in that you're going to?
I think you touched on what my recommendation would be. I think you've got the framework for it already. GW has a persistent, perhaps not persistent, but has a continual involvement. And I think that, to me, is the key, is that this isn't a one and done and you're out. You have this rotational experience here. So I think the key would be find the NGO that is persistently present and partner with that NGO with a long-term objective, a long-term strategy, rather than I'm bringing down like 25 or 30 people this time. What's today's project? What's this week's project? In other words, if you could do your short, medium, and long-range objectives and partner with a single NGO toward that end, that's a nice model to follow.
I guess I would say that George Washington is a world-class educational institution. And, look, I don't know what your programs are, and MSHS is also a very good institution. But if you focused on something where you could help Haitians develop the capacity to do something in the educational field. So let's say, I don't know, emergency medicine. It's world-class capability of GW. If in your effort you could help them develop emergency medicine or some other sort of component so that you could teach them to teach, the rest of the community how to do something like that. And that when you leave a capacity to do this. That would be, I think, probably the most effective way to make sure that GW's efforts contribute to the building of a comparable capacity in Haiti. When I was at the Clinton Bush Haiti Fund, we found there's some great Haitian scientists and experts in the U.S. and even in Haiti who hadn't left. They're really totally committed people, and so we supported an effort to rebuild the School of Sciences at the University of Haiti because it was a school that people attended, Haitians attended without tuition or minimal tuition. It was a state school. And this was the school that trained engineers. And our feeling was that what Haiti needed to rebuild was a bunch of engineers and architects, right, who could build things and build them to earthquake standards. And so we gave a grant focused on reconstructing and rebuilding the capacity to train Haitian engineers. That was the idea, and I think it was effective in a small field. But I would suggest that rather than kind of spread yourself across disciplines or across different things, try and focus on something that they need that you can do for them in a short period of time, and then they can carry on.
But it's both of those things that are really important. It's not just doing something you can do.
No.
It's doing something that they need.
That they need. So,
Like I said before,
and that you can know, but they both have to intersect.
Yeah, but the answer to the question could very easily be, well, we're really not contributing. You know, I mean, if you take an objective look at it, I'm not saying that's the case with Washington University. I would say that's the case with many, maybe the majority of NGOs, and you cited the church groups who go through.
There are 10,000 of them.
They're not giving anything that Haiti needs, and maybe they're educating them. I mean, you know, I don't go around the circle. But it's really important to have that emergency medicine people, we call it triage. Somebody to be the triage officer. And that's what Haiti is. More than anything else, is a triage officer. To say, it's okay if you do this, but if you're coming to do that, we don't want. You said before, I think, if they had somebody to say no, they'd be in much better shape.
Right.
And they need to be able to say no to that.
They need to be able to say no.
USAID or any other donor organization, or, you know, that's where I think that we've all failed in some ways to establish a government that can speak with a strong and authoritative voice and take charge of their own development. We're supposed to be there to be helping a legitimate government authority move the country forward. And I know that there's been intense and incredible amount of activity since the earthquake, but it's been going on for a very, very long time prior to the earthquake as well. We shouldn't fool ourselves thinking that, you know, that we're not at least partially responsible for Haiti finding itself in the position of being the country in this hemisphere closest to the United States, with the worst social parameters across the board and economic parameters across the board. And so it's not, you know, this isn't a newfound, well, it shouldn't be a newfound position in any way. And I think that we will benefit from examining our mistakes of the past and making sincere efforts to correct them and to put ourselves in the proper position to help these people.
I have a colleague, former military colleague, he's a general surgeon working in Ethiopia with an NGO, and their sole focus is that they train Ethiopian surgeons, and the requirement is you stay in Ethiopia. Because there's the other problem, if you go and you train in a different capacity that meets a marketable demand outside of Haiti, okay, well, I've got my certificate of training, and off I am with the next thing going to the place where I can make the most money. That's what that is the danger. So that's certainly something to say.
That's also true in Haiti, where we run into a number of very competent doctors down there. There's a chance they get. They're in Canada, they are in Spain, because they're upwardly mobile and there's no incentive.
Right.
So,
Especially
we've been in a situation where we've trained and well trained, go down, oh, yeah. In fact, we moved to Canada.
especially if they're being trained by US institutions having programs, and they have those degrees.
What happened to the Schweitzer Hospital? I don't know the current situation. I'm a couple of years out of date on Haiti, but when I was working at the Clinton Bush Haiti Fund, the Albert Schweitzer Hospital came to see us, and this is an extraordinary institution. It was established like 100 years ago, but the remarkable thing about it is that there's a board of directors. It's a U.S. 501c3 based in Pittsburgh or Pennsylvania somewhere, and they supported the development of this hospital. But all the staff are Haitians. The director's Haitian, all the doctors, the nurses, everybody's Haitian. And they have lived basically by charging Haitians for medical care. So you go in and you have dialysis, and it costs $20 or something like that. But they actually get fees from medical care provided for Haitians. So a little bit like the education system is predominantly private with very low standards, and it breaks your heart to see Haitians making these sacrifices for their children, and then the children aren't really getting what they're paying for it, but I digress. The Albert Schweitzer Hospital came to see us in Bush and said, we're being killed because since the earthquake, all of the NGOs are coming out and setting up free clinics. So our people are sick, but our workload, our paying customers have dropped off the cliff because why would anyone pay the Albert Schweitzer Hospital when you could go to Doctors Without Borders or somebody else and get it for free?
And did that happen with rice farmers and?
Many cases of that's the one I happen to remember because we're talking about medical, but it's a problem, and we need to acknowledge the problem. And I felt, I mean, these guys are just so fantastic. It's a Haitian family, all these people, and he says, I'm losing my doctors to the other NGOs, and I'm losing my patients to the other NGOs, and I don't think we'll be able to make it. Now, I don't know what happened. It was a couple of years ago, so they may have hung in there, and people, the provision of free services declined, and maybe they're still around.
We did it, and I wish I could say that we've never done it, but we did the identical thing all along the Somali border. We went, our standard package was a week's worth of medical civic action, a week's worth of veterinary civic action. Well, the local veterinarian was making money, and we rolled in and we started immunizing herds for free. We were on the Somali border. He started spreading some rather unpleasant rumors about what we were there to do, and it became a very tenuous situation for us, and it was simply cutting into the guy's livelihood. It's a factor we don't often think about.
Right. I actually when I was in Iraq, I talked about trying to require something called an incentives impact statement. So someone comes in with a USAID proposal or concept or something like that. I said, okay, we got environmental impact statement. I want an incentives impact statement. You got to have 2 pages in this proposal in which you say what is the impact of this proposal going to be on incentives to everybody in the industry. And I was unable to sell it to anybody. Everyone thought, oh, we can't do that. We want to put something in there, then we'll get judged on it. So forth. I was a total failure, as I am in many things. But I do think that is an issue. And as we think about development going forward for donors, we really ought to think objectively and a priori about what will be the effect of what it is we do on incentives for everybody. Now, maybe we still want to do it for one reason or another, but we ought to think about it. Your example about the wells that we drilled with SERP in Afghanistan, we drilled wells because they were easy for us to drill.
And to count.
And to count. Yeah, to count, right, and to measure. But the impact was destroying the environment, reducing the water table, making an unsustainable investment. Fortunately, the wells, after we stopped drilling them, they started filling in and things recovered. But it is a problem.
One quick question. You give me a rough idea because this one thing about there was altogether 5 billion, 10 billion worldwide donated or
pledged
to the Haiti.
Do you know the numbers, I think?
How much actually was donated, physically donated, and how much actually ended up on the ground, direct services there as opposed to transportation and overhead and all the rest? So
there was about $12 billion pledged, but over 10 years. So it's hard to say how much of that will actually come because it's not been 10 years. I'm trying to recall the last update was December of 2012, I believe, by what was then President Clinton's office at the UN Special Envoy. And I'm thinking that was around 50%, but I would just suggest that you check the website to get the exact number on that. And then in terms of how much is actually spent in Haiti, that's an interesting question to ask, and I'll speak in terms of U.S. assistance. Most of the money that we give does not go directly to Haitian organizations, but that isn't to say that the resources aren't given to Haiti. Just because we give the funding to an international contractor or NGO, doesn't mean that that money is staying in the United States. I mean, in some cases it is in salaries, but then those people are then going to Haiti and hiring Haitian employees and providing assistance in Haiti. So I don't think that question is so easy to slice and dice. And then also, if you look at, the humanitarian relief phase, you don't want to give that to a Haitian organization. They were destroyed. You want to give that to an international organization that already has an airplane loaded with goods and is ready to go and understands how to move instant relief. Over time, this does need to move toward Haitian organizations, but as was mentioned, there is an absorption capacity challenge there. We have a new contract with our Haiti Future program in the north that will be very interesting. It took a long time to procure, and part of the reason for this was that AID wrote into it that the contractor will begin to lose profit by quarter in the last 2 years of the contract if actual management responsibility has not been turned over to local organizations. So it's part of their job not just to improve agriculture in the north, but to build up local organizations as their partners and then transfer actual responsibility and authority to them. So that we're a couple years out from seeing how that will be, but it is one of the first of its kind.
Needs money test.
So it's a regulation of U.S. NGOs basically operating in
Well, setting up the right incentives. So one of the problems that you have with U.S. NGOs that have external funding is there's no incentive to them to solve the problem because then they work themselves out of a job.
Right.
So you need to change those incentives so that that they really do train the local capacity, because otherwise their incentive is to we have this really wonderful, well-working feeding program in the north of Haiti, and so you spent $150 million on the last 3 years. You need $150 million in the next 3 years, maybe 200. Whereas if you really want to disintermediate the foreigners in providing these things, you need to set up incentives in such a way that they don't have an incentive to basically roll over the programs.
I guess the corollary there is that they also tend to end up in these urban population centers, like Haitian or
The foreigners, you mean?
The foreigners,
yeah,
the NGOs, because it makes their numbers look great as far as their metrics are concerned. They're able to reach this many people and work in this area. But the periphery, the rural area, say like Tomo and the rest of the South where we were, they never see anybody except that, here comes another 25 university students. They're here, but we've never seen an actual NGO.
There's a component of that, and I ran into it when I was in East Africa. I didn't have a bunch of doctors that I could reach out to. I was begging, borrowing, and seeing, and then you get that I need to borrow 1 or 2 doctors. Can I borrow this doctor? Once the word got out that Kenya was fun and nice and had some infrastructure, I was kicking them, off the aircraft on our way to Kenya. But when we were going down to the village in Djibouti, which is, my unit was out of Florida and had a lot of people there who were Haitian. Of course, this was prior to the earthquake, and they said that Djibouti made Haiti look like a vacation spot. I mean, Djibouti's pretty rough. I couldn't get people to go there. So that's a factor that you also run into. Is I go back to this voluntourism. It's this, I want to go do something good. I don't really want to go more than a day or so without a shower, but I do want to do something good. When you get out into some of these regions, you can go a week without a shower if you have to. That's a factor.
This is one of the students who will be on maybe in a couple of weeks. I know that we are definitely going to gain a lot of education. We are going to be providing some services to the Haitian people, but do you have any suggestions on what we can do to make sure that the people of Haiti get the most out of the work they're doing?
I'm going to answer that completely differently, and I'm going to say this after 20-some odd years of experience. make sure you get the most out of it. Immerse yourself in anything and everything culturally that you can. Eat with them, dance with them, talk with them, listen to their music. In doing that, you'll arrive at that answer yourself. Because now you're going to know the people, you're going to know the community. You may not be able to tackle what you identified on that trip, but you will then be able to tackle it on the subsequent trip.
And that's part of the mission of an educational institution to begin with. That's why we send students. That's when we try to get students involved so that they would understand the issues at hand intimately. They would become very familiar with them, so that then these kinds of discussions could take place, and that's the future generation of people who would be participating in the interactions that we're talking about. So, part of our mission, part of what we do as institutions.
I would add on, I agree with everything they're saying. It can be life-changing. I don't know if you've been to developing countries before, but for someone who hasn't, it is a life-changing experience and maybe can inspire you to a life of service, or at least of appreciating what we have here. But I would also say, and I don't know what you're going to do, but whatever it is, if you're giving something or whatever you're leaving behind, make sure it is something that they can actually sustain with the resources that they have. Don't bring them some fancy microscope that they can't maintain or use. Just think about everything you're doing in the context of what their life is going to be like after you go.
Here's your 110-volt toaster for a 220 electrical circuit that you don't have in your house.
For your winter clothes.
Right, we brought donations.
Listen to them; they'll teach you a lot. All right.
All right. Well, I'd like to thank our panelists for joining us this evening.